Now guys, how will you calculate the power of the eye? How will you check for the power? So basically, patients will be coming to your clinic saying that, doctor, my child is not able to look at the, basically there will be a parent coming to you saying that, doctor, my child is sitting at the back and he's telling that in his classroom he's sitting at the back and is telling that he's not able to view or he's not able to see the blackboard properly. Okay? So he's not able to see the blackboard properly. Yani ki his far vision is a problem. Okay? And some of the parents will be coming to you, that will be rare guys. Second case will be rare. They will be coming to you and telling that, doctor, my child is not able to read the near things properly. These two conditions are very common. These two conditions are very common. Basically, I am talking about two conditions of the eye or two refractive errors of the eye. First, the child was complaining that he is not able to see the board properly. Or sometimes the parent might tell that, doctor, my child is seeing the board, but he's finding it very difficult to read the letters. While reading the letters, he is half shutting his eyes. Yani ki if the child is not able to see the letters, or if the child, while looking at the far things, if he is doing half shutting of the eyes, basically he's trying what? He's trying to put the light rays on the retina. Remember guys, if this is the retina, if your light rays focuses on the retina, you are having no problem. But look over here. Look over here guys. Imagine this is the eyeball. Okay? And here is the retina. Okay? Whenever a light is being passed, or whenever we see an object, right, it should focus on the retina. The light should focus on the retina. If it is focusing on the retina, you won't have to wear any glasses. But in some patients, what happens is, look over here guys, in some patients, what happens is, again this is the cornea, here is the retina guys. Here is the retina. In some patients, what happens, the light rays focuses before the retina. The light rays, where it is focusing? The light rays are focusing much before the retina. If the light rays focus much before the retina, what will the child do? The child will try to squeeze his eyes to look at the far thing so that the light rays should focus on the retina. But normally the light rays are focusing over here. This condition is called as what? This condition is called as myopia. This condition is called as what guys? Myopia. Okay? So the first child is having myopia. Myopia means what? He is not able to see the far things properly. He is not able to see the far things properly. That is called as myopia. Next is what guys? Hypermetropia. Hypermetropia. The second child I told you what? The parent will be coming to your clinic. That's very rare guys. Okay? Hypermetropia is not commonly seen in children, but if it comes, what is the complaint? The child is not able to read the near things properly. Why he is not able to read the near things properly? Once again guys, this is the cornea. Here is the retina. So what will happen guys? Now the light rays are focusing where? Behind the retina. If the light rays focuses behind the retina, such condition is called as hypermetropia. Hypermetropia. So we'll discuss what is myopia, what is hypermetropia later. We are discussing about what? If at all the child complains that, or if the parent complains that his child is not able to, or the child is not able to look at the far things properly, first the doctor needs to examine what is happening with the child. Doctor makes a diagnosis that it is myopia, but you have to justify your diagnosis with investigations. So what investigation that we do for myopia? We go for a charting. Normally that we go for a charting called as Snellen's chart. Snellen's chart. So what we do, we call the child into a room where a chart is being shown. The ones who are myopes, who are listening to my class, those who are myopes, they might be familiar with this chart guys. They might be familiar with this chart. What is this chart called as? Snellen's chart. So the child is brought to a room where he is made to sit in front of a chart, where he is made to sit in front of the chart, not exactly in front like this. There is a distance between the chart and the child. What is the distance at which the child should be sitting in front of the chart? 6 meters. The child should be sitting at 6 meters. Then the doctor will be asking the child, please read the alphabets. Alphabets E, F, P and all. Yani कि first, without giving any glasses, he will tell to read the chart. Okay? So basically, after making the child to sit in front of the Snellen's chart, the doctor, after assessing his vision, he will write something like 6 by 6 or something like at which a normal person can read the chart. The distance at which a normal person can also read. At which what is the upper 6 means? It is the distance between the patient. I am the patient. It's the distance between the patient and the chart. That is the upper 6. Lower 30 means what? The distance at which a normal person can read the same line. 6 by 30 means what? I am standing at 6 meters and still I'm finding it difficult to read the chart. Whereas a person who's standing at 30 meters, he's much behind. He can read. My vision, it is low vision. So remember guys, any vision from 6 is what? First of all guys, just look over here. Imagine I am sitting in front of the Snellen's chart. My my testing is being done. Okay, I am sitting in front of the silence chart. At 6 meters, I am not able to read the line. Whereas the person standing at 60 meters, he is able to read the alphabet E. So what will the doctor tell me? The doctor tell me I am having poor vision, but before telling me poor vision, what will the doctor assess? He have to first assess how is my vision. So what he will tell? He will tell me move 1 meter ahead. So what I will do? I will move 1 meter ahead. Yani ke I will try to read by 5 meters. I will be telling doctor still I am not able to read. The doctor will tell move 1 more meter ahead. I will now move 1 more meter ahead. I'll be standing at 4 meters. I am trying to read, but still I am not able to read that alphabet E. Okay? But the person at standing at 60 meters, he is able to read it. Then now the doctor will say to me that move 1 more meter ahead. Yani ki at 3 meters also, if I am not able to read, basically I am blind. But still doctors don't give up. What they do? If I am not able to read by 3 meters, at least the doctor will come in front of me and he'll at least tell me how many fingers are there. Yani ki he tell me to count the fingers. I'm not able to count the fingers. Still he is not giving up. The doctor tells me, are you able to appreciate my hand movement? I'm still telling doctor, I am not able to appreciate your hand movement. The last thing before giving up on me, what will he do? He takes a torchlight and he puts a torchlight and he tells you, are you able to feel light is being put into your eyes? Are you able to feel the light? If you are not able to perceive the torchlight, yani ki perception of torchlight is also, perception of light is also not seen by you, that means you are a case of irreversible blindness. Irreversible blindness. But once again guys, for far vision testing or for myopia, we go for a Snellen's chart. In Snellen's chart, 6 by 6 means what? Upper 6 is the distance between the patient and the chart. Lower 6 is the distance at which a normal person can read the same line. Okay. Now in the Snellen's chart, if the patient is not able to read by 6 meters, you tell the patient to move a bit ahead. If he is still not able to read by moving ahead, you tell him to count fingers. Still if he is not able to count fingers, at least hand movement. If hand movement is also not possible, last is what guys? Perception of light reflex. Alright guys. So look over here guys. So Snellen's chart, I already told you 6 by 6 or 6 by 60, what does it mean and all, okay? Now, right. So you can just write there 6 by 6 means what? Upper 6 is distance between patient and chart. Whereas the lower 6 means what guys? What is the lower 6? It is a distance at which a normal person can read the same line. A normal person can read the same line. If the person is not able to read by 6 meters, then we tell them what? Then we tell them to move 1 meter ahead. 1 meter ahead. And read the line. And read the line. If after moving the person 1 meter ahead, still he is not able to read, then if still not able to read, then what we'll do guys? Then we tell him to count fingers. If still he is not able to count fingers, Then we tell him for looking for the hand movements. If still not able to read after hand movements, then last is what, guys? Perception of light. Perception of light reflex. Perception of light reflex. If perception of light reflex is positive, then okay. But if perception of light reflex is negative, yani perception of light reflex is positive, means still he is having a very low vision. Very low vision. Okay. Nearly blind only. But if perception of light is totally not possible, then the person is absolutely irreversibly blind. Irreversibly blind. I told you 6/6 to 6/18 is a normal. 6/18 to 6/60 is low vision. Less than 6/60 is blindness. But as per WHO, what's the definition of blindness, guys? As per WHO, any vision of less than 3/60 is called as blindness. Okay? That's regarding what, guys? That's regarding the Snellen's chart and all. Snellen's chart. Now, guys, what else we need to remember? Now, this was for the literate person. Literate person can read the alphabets. By looking at the Snellen's chart, literate person, literate yani ke educated person can say this is E, this is P. How about the illiterate people? Myopia can happen to every individual, right? If the person is illiterate, then how will you go for the testing? You go for Snellen's chart, but Snellen's chart for illiterate, we don't go for this alphabet chart. We go for two charts which are called as illiterate E chart or Landau's ring. Now you must be wondering, sir, how will an illiterate go for an illiterate E chart? This is illiterate E chart, guys. How will an illiterate know this is an alphabet E? We won't be telling that this is an alphabet E. What we will be asking, this is some alphabet over here. Just tell me, we will be telling him what? Just tell us where is the strokes pointing? Where is the strokes of this alphabet pointing? And we will ask. So remember, guys, for an illiterate person who is suffering with myopia, we don't go for Snellen's chart, we go for illiterate E chart or we go for Landau's ring. We go for Landau's ring. For illiterate, we use this. For illiterates, we use this chart called as Landau's ring or illiterate E chart. That's regarding this thing. That's regarding this. Now, guys, imagine there is a person there is a child who's suffering with myopia. Child means he is a preschool child. Preschool means 2.5 years or 3 years old child who's having some problem with distant vision and all. The parents were suspecting he might be having problem in the distant vision. 3-year-old, they won't tell, but the parents were suspecting. They gave for the eye test. The 3-year-old, he don't know the alphabets and all. For a 3-year-old, if you want to test his vision for myopia, you can go for two charts. Now, those are called as Allen's chart and Lee's chart. Allen's chart or Lee's chart. Okay? Allen's chart or Lee's chart. We show this chart to the patient. Allen's or Lee's chart. These are picture charts. Picture charts. Okay? Now, sometimes there might be a pre-verbal child. Pre-verbal yani ke 0 to 1 year old child, in which the parents are suspecting some myopia. Parents are suspecting that this child is not able to remember, guys. When the child is born, normally he is not able to look at the things properly. It takes 4 to 6 months for the foveal fixation and accommodation to occur, right? So, but still after 6 months, the parents are noticing something, that the child is not able to appreciate the things beyond 6 meters and all. So, they are suspecting the child might be having myopia. For a pre-verbal child, we can't show them any chart. Why? Because they are not at all talking and all. For a pre-verbal child, if you want to know what myopia they are suffering with, or are they suffering with myopia or not, you have to go for a testing which is called as visual evoked potential testing, or this is also called as visual evoked potential testing, or we can check the myopia by optokinetic nystagmus. Optokinetic, by to and fro movements of the eyeball, we can check for the myopia, right? So remember guys, we are talking about what? Literate. For educated individuals, we go for Snellen's chart for eye testing, for far vision, like if the patient is having myopia. If for illiterates, we go for Landau's ring or illiterate E chart. For preschool child, we go for Allen's chart or Lee's chart. For a pre-verbal child, we go for what? Visual evoked potential and optokinetic nystagmus. Visual evoked potential and what, guys? Optokinetic nystagmus. Right? So for pre-verbal child, we go for visual evoked potential or optokinetic nystagmus. Visual evoked potential, but the best test is optokinetic nystagmus. Okay. So what if you want to check the patient's near vision? For near vision, there is a testing called as Jaeger's chart. Okay. But before going to Jaeger's chart, first of all, guys, you need to understand something about accommodation. Accommodation. Come on, I told you what is accommodation. Accommodation is what? You were looking at the far thing. Suddenly I tell you to focus on a near point. Suddenly you are shifting your vision from a far to a near object. What happens? Your eyes accommodate. In the eyes, what helps in accommodation? The ciliary muscles. But what is the structure that undergoes accommodation? The lens. The lens undergoes accommodation. And what is the first sign that your eyes had undergone accommodation? Just look over here, guys. You can do this experiment. You look at some far thing and suddenly you move your vision to a near thing. The first sign of accommodation, suddenly you will see blurring of the image. The first sign of accommodation is blurring of the image. So inner eye, what undergoes accommodation? The ciliary muscles. And what undergoes accommodation? The lens. Who helps in accommodation? It is the ciliary muscles and the zonules. So during accommodation, what happens? The ciliary muscles contract and the ciliary zonules relaxes. So just write there, guys. Accommodation. Accommodation is the process of shifting your vision from a far object to a near object. Right? Ciliary body helps in accommodation. Accommodation. But what is the structure that undergoes accommodation? Lens undergoes accommodation. Lens is the structure that undergoes accommodation. Right? Lens is the structure that undergoes accommodation. So if lens is lost, you can't do any near activity. Accommodation will be lost. Okay? So accommodation, whenever you are accommodating, remember, whenever you are accommodating, your eyes will converge or diverge? Converge. Accommodation and convergence are always linked together. Now guys, look over here, look over here. During accommodation, what will contract? The ciliary muscles contract, the ciliary muscle contract and ciliary zonule relaxes. During accommodation, the ciliary muscles contract and the ciliary zonules relaxes. Right? And what is the first sign of accommodation? I told you, as you move your vision from the far to a near thing, the first sign of accommodation is what? The first sign of accommodation is visual blurring. Visual blurring. Okay, the first sign of accommodation is visual blurring, right? So guys, remember, sometimes when you excessively do accommodation, yani ki during your exam time and all, during your exam time you guys read a lot. We have to read a lot during exam time. We read for 16 hours and all. Due to some excessive accommodation, while you are reading, you are basically concentrating on the near. Reading means near vision. Okay? So for near things, yani ki you keep the book in front of your eyes and you read. So as you are keeping the book in front of your eyes and reading, your eyes are accommodating. Due to this constant accommodation for a longer period of time, sometimes the person might develop pseudo-myopia. Pseudo-myopia. But again, it's just for some time only. Transient period of time. Okay. So accommodation is an important thing for near vision. And what undergoes accommodation? Lens. If lens is gone, there is no accommodation and near vision will be at problem. Okay. So for a near vision testing, guys, we were talking about near vision testing, right? For near vision testing, you go for this chart. This chart is held at this chart is held near to the patient and you will be asking the patient to read the line. Okay? So this chart is called as Jaeger's chart. Jaeger's chart. For near vision also, there is a chart which is called as what chart, guys? Jaeger's chart. This chart is held at 35 to 40 centimeters and we tell the patient to read from bottom to top. We tell the patient to read from bottom to top. And this chart is called as what chart, guys? Jaeger's chart. This chart is called as Jaeger's chart, which is used for near vision testing. Near vision testing, right? So this was regarding the near vision.